Iran is reporting that a second lawmaker has died of COVID-19 infection. The victim is 55-year-old Fatemeh Raghba. She was recently elected to the parliament from Tehran. Iran is the hardest hit country in the region. So far, its total number of confirmed cases has surpassed 5,800. And there was a surge of more than 1,000 cases from Friday. Over 1,600 patients have recovered. Several neighboring countries, including Saudi Arabia and the United Arab Emirates, have banned travel to and from Iran. Now, for the latest situation there, let's talk to our correspondent Hosein Neamatzadeh in Tehran. Hosein, let's start with this worsening situation in your country. Has the government issued more and tougher measures to deal with this outbreak?
Yeah, actually, according to Iran Health Ministry, the number of confirmed cases, the official number of confirmed cases are based on clinical results. So at the beginning of the outbreak, the number of confirmed cases, at the beginning of the outbreak, the number of kits and laboratories were not enough. After China and WHO brought more and more kits, the number of confirmed cases dramatically soared. In regard with Iranian measures, the Iranian has closed schools, universities, cinemas, theater halls, public places. Students are studying through televised and online courses. Iran has launched a huge national mobilization campaign to fight coronavirus, in which 300,000 people are involved, including armed forces. They are going to check each family if there is any symptom, if any of them have any symptom, to separate the infected and confirmed cases from other family members and put them in home isolation, to avoid any crowds, unnecessary crowds in the hospitals, and also treat some of those who have mild symptoms at home. Some provinces also declared travel restrictions. They call hotel, hostels, guest house not to receive any tourists especially during New Year holidays. Armed forces also constructed and are constructing some field hospitals in epicenters like Qom and Qazvin.
So, Hosein, let's talk about another critical juncture coming up, Iran's New Year. It's on March the 20th. Looking at the situation now, would you say that the planned celebrations or even domestic travel will be halted?
Yes, we are on the eve of Iranian New Year, Nowruz. In the past year, same times, it was shopping season. People were preparing themselves for holiday, for visiting each other, traveling. But now if you go to Tehran streets, Grand Bazaar, metro station, you will see less people, less traffic, less crowd, less shopping. People naturally are not happy with this, but it shows that they are following instructions. They are well informed. On the other hand, there are a number of people who haven't taken it serious. After Iran government announced closure of the schools and universities, they wrapped up and start traveling. Yesterday, Health Minister actually expressed his concern and complained and blamed such people and warned them if they are not going to listen, they will take tougher measures, maybe using force. But anyway, Tehran is not as vivid as before.
So let's talk about treatment, Hosein. Would you say, from the information you've gathered so far, the treatment methods are improving?
The number of recoveries is dramatically also increased. The WHO said that Iran has one of the best medical system and service in East Mediterranean region, as well as well-educated and experienced medical personnel and staff. Also, Iran Health Minister said the medicine they used to treat coronavirus cases was very effective and more than some other countries engaged with this issue. Also, a spokesperson of Health Ministry told me that the experienced Chinese expert team shared with us could take us forward for a few months, not to gain experience through trial and error too much.
Thank you very much and take care. Our correspondent Hosein Neamatzadeh in Tehran.